Good morning. We're here to give an update on COVID-19 in Oregon, and I'm joined by Patrick Allen, Director of the Oregon Health Authority, and Dr. Dean Seidlinger, our state epidemiologist. Before we give a COVID update, I wanted to start this morning by addressing the mass shooting at a FedEx facility in Indianapolis. We will be lowering flags to half staff in Oregon to honor the victims. My heart goes out to their family and friends. I also want to acknowledge that it's been a difficult few weeks for many Oregonians as we are called again to speak out against the undeniable injustice of police violence. Daunte Wright was just 20 years old. He loved basketball. He was a father. He should still be alive today. Adam Toledo was just 13 years old. He too should still be alive today. They and their families are in our hearts. And the struggle for justice is at the forefront of our agenda. It's been just over a year since the first COVID case hit Oregon. Today, as the state exceeds more than 700 cases, it's clear that this virus is persistent and it's stubborn. While we've flattened the curve again and again, COVID will not surrender. But in the face of rising cases, we know that this time can be different, and here's why. We know what to do to protect ourselves and our loved ones with masks and distancing, and today we have a very powerful tool: effective vaccines. Vaccines are the best way to protect yourself from serious illness and death. They are the best way to protect yourself from variants, and they are the key to unlocking the restrictions this pandemic has forced on us so that we can return to doing the things we love and seeing the people we miss. This Monday, vaccine eligibility will open up to everyone age 16 years and older. My message to Oregonians is this: if you haven't already had a chance to get vaccinated, make a plan to do so now. Tell your loved ones and neighbors your plan to get vaccinated and share your reasons why. And if you've already signed up for an appointment, help a friend sign up too. Ask questions. And this is really critical. As our friends, families, and neighbors await their vaccine, please keep them safe. We have to stay with the basics. Wear your mask, limit gatherings, especially with friends and family who aren't fully vaccinated, and maintain social distancing. With almost 1 in 4 Oregonians fully vaccinated every single day, we're getting closer to reaching the community protection we need from the virus. We must keep our eyes on the horizon and honor the personal responsibility we all share to follow public health safety measures. There is so much to look forward to, and we're almost there. Before I turn it over to Director Allen, I want to share that as of this past week, we have nearly 300,000 kids back in school. I've had the chance to visit several schools over the past few weeks. It's very uplifting to see our kids smiling in their classrooms, and the teachers are smiling too. Last, I want to end with an important announcement unrelated to COVID. We're entering a weekend of unseasonably warm weather and east winds. Many areas of the state are under advisory alerts for elevated fire danger over the next few days. Please take a moment to assess your readiness to respond to a wildfire. We learned the hard way last year just how quickly things can spiral. Be prepared and stay safe. And with that, I'm going to turn it over to Director Allen.
Thank you, Governor Brown. Before I provide a brief update on vaccinations, I want to recognize the fact that vaccinations in Oregon have not been administered as equitably as they need to be. The numbers are stark and clear. For too many people, race and income are predictors of whether you can access a COVID vaccine or not. Yesterday, I heard the leaders of organizations who serve the Latina community voice their legitimate frustration at the inequitable disparity in vaccination rates for their community. I share their frustration. As a state, we can and need to do better. We've pursued a strategy to close those gaps in a variety of ways. We've prioritized vaccines to federally qualified health centers that serve a disproportionate population of Latino and Latina patients and opened eligibility to everyone they serve, regardless of age, occupation, or underlying health condition. We've prioritized doses for migrant and seasonal farm workers who've experienced some of the largest outbreaks in the state. We've conducted intensive outreach across the state through our Community Partner Outreach Program and worked with more than 170 community-based organizations to inform and engage the community through co-produced outreach materials in 11 languages. We've provided more than $17 million in grants to CBOs for vaccine-focused outreach, in addition to more than $56 million in grants to nonprofits to address health equity. But these strategies have not been enough. The under-vaccination of the Latino community continues to be a profound shortcoming in our state COVID-19 response. OHA and our partners need to do more. As I've said since the outset of this vaccination effort, if we only prioritize the speed of our rollout, many will get left behind. High-throughput vaccination clinics like the Salem Fairgrounds and the Oregon Convention Center have been important tools, and we're grateful for the health systems that have stood those up and operated them. But they're not sufficient alone. We need to refocus, reimagine, and redeploy our efforts to get vaccines out into communities that are hardest hit and most at risk. That takes time to build relationships, win trust, and be there at the right place and time in the community when someone makes the decision to get vaccinated. I'm committed to working with leaders in the Latina community to redress the disparities in our vaccination rates. I'm committed to making sure our healthcare system and our vaccination efforts do a better job at serving people of color and eliminating health disparities. I look forward to working with community leaders across to address the recommendations and ensure everyone in Oregon has fair access to vaccines. Now, as we prepare to open vaccine eligibility to all Oregonians who are 16 and older, here's a quick overview on the progress of our vaccination efforts so far. More than 1.5 million Oregonians have received at least one dose of a COVID-19 vaccine. As of yesterday, the total was 1,516,589. 37% of Oregonians have received at least one shot. 42% of the population 16 and older have received at least one shot. Nearly 1 million Oregonians today are fully vaccinated. Oregon has completed full 2-dose vaccinations or single-dose Johnson & Johnson vaccines for over 966,000 people. Overall, 23% of Oregonians have been fully vaccinated. The capacity of Oregon vaccination sites to immunize Oregonians continues to increase. As of yesterday, Oregon is averaging 38,728 doses administered each day. And nearly 3 in 4 seniors have been vaccinated. As of yesterday, 765,542 people who are 65 and older have received at least one shot. Let me give you a brief update on our projected vaccine supplies. As you know, this week saw a pause in the distribution of the Johnson & Johnson vaccine. This pause is evidence that the precautions that are in place to ensure vaccine safety are working to protect people against adverse events. No matter the outcome of the evidence review, we know it will be based on the best available science. In the meantime, the loss of Johnson & Johnson continues to put curbs on the pace of our rollout. Previously, we expected the Johnson & Johnson manufacturing shortfall would result in about an 8 or 9 day setback in having enough doses to vaccinate all eligible Oregonians. Now we're holding off on our projections of Johnson & Johnson vaccines for the next month until we know more. That continued shortfall means as many as 70,000 fewer vaccine doses per week. For the week of April 19th, we're expecting 154,000 prime doses. That's consistent with what we're receiving this week and does not include any Johnson & Johnson doses. For the week of April 26th, we do expect a similar amount of prime doses. Until we receive clarity on when Johnson & Johnson shipments will begin, we would expect to see approximately 154,000 prime doses per week into early May. What do those temporary supply limitations mean for Oregonians who are looking for a vaccination? We'll continue to see tight appointment availability in many parts of the state for the coming weeks, at least until we know more about the availability of the Johnson & Johnson vaccine. However, we still expect to have enough doses to vaccinate all Oregonians who are 16 or older before summer. And as Dr. Seidlinger will describe, it's vital for every Oregonian to get vaccinated. Now let me turn it over to Dr. Seidlinger.
Thank you, Director Allen and Governor Brown. I want to begin today by summarizing where things stand with the pandemic in Oregon and follow that with an urgent plea for every eligible Oregonian to get vaccinated. As of today, OHA has reported 173,626 COVID-19 cases in Oregon. But recent data are troubling, showing that the virus is again on the march throughout our state, sickening our friends and neighbors. Daily cases, hospitalizations, our positive test rate, and sadly, COVID-19 deaths are all on the upswing. Daily cases of COVID-19 have more than doubled in just over a month, increasing from a 7-day moving average of 249 on March 6th to a daily average of 595 cases. Over the past 2 days, OHA has reported over 1,500 cases, the highest 2-day total since early February. And in our most recent report, covering the week of April 5th through the 11th, OHA reported 3,722 cases. That is 26% higher than the previous week, and that week was 21% higher than the week before that. In fact, we have seen 20+% increases in our cases for 3 weeks running, eclipsing even the most pessimistic scenario in our most recent COVID-19 modeling. The percentage of positive COVID tests has followed a similarly concerning trajectory, climbing from a 7-day moving average of 3.9% on March 6th to an average of 4.9% yesterday. Correspondingly, hospitalizations are increasing quickly as of late. Hospitalized patients testing positive for COVID-19 are up 26% for the first 2 weeks of April. Our hospitals reported a 17% increase in COVID-19 patients in March. This was after seeing declines throughout the months of January and February. OHA reported 47 COVID-19 related deaths for the week of April 5th through April 11th, the highest toll in 5 weeks. And to date, there have been 2,457 COVID-related deaths in Oregon. My thoughts go out to everyone who has experienced a loss to COVID-19. Over a year into this pandemic, every loss hurts. 2 weeks ago, I warned that with rising spread of disease, counties might move into increased risk levels in the coming weeks. Unfortunately, that caution has been realized. As March ended, there were 28 counties assessed as low to moderate risk. Today, there are only 22, and several counties are facing possible risk level upgrades in the coming weeks. We are all tired of fighting COVID-19, tired of wearing our masks, tired of missing our loved ones, and tired of keeping our distance. But we must continue to fight. As more of us and our family, friends, and neighbors get vaccinated, we must continue to wear our masks, limit our higher risk indoor gatherings, and keeping our distance. Variants are increasing at alarming rates, spreading COVID-19 faster and sickening more of our neighbors. Let me share some stories of ongoing spread. It's worth noting that several outbreaks involve large social gatherings where people were not socially distant or wearing masks. There was a multi-night karaoke event that led to 36 cases, 3 of whom were hospitalized, and tragically 1 death. There was an indoor concert at a small music venue where we saw 15 cases coming from that event, and a backyard gathering with 10 people, with all of them falling ill. It's another reminder that even small lapses can have consequences. Today, we find ourselves at another inflection point. Our actions over the next few weeks will determine when and whether we are able to escape the pandemic. We have worked diligently since March to protect ourselves, our loved ones, and our communities. We have stayed home. We have moved celebrations online. We have missed mourning with our families. Some of us have lost jobs, and all of us have made tremendous sacrifices. We have worked diligently since December to ensure that the people most at risk of exposure are healthcare workers, first responders, residents and staff of long-term care and other congregate settings, people over 65, and those with underlying medical conditions. Frontline workers, members of multi-generational households were vaccinated first. Every day, we are working with our local and healthcare partners on strategies to reach the most vulnerable Oregonians and those who have been most affected by the pandemic. Our data shows we need to do more to get to our hardest hit communities, to get them vaccinated, especially in the Latino, Latina, and Black communities. Oregon vaccinators are administering on average more than 38,000 doses a day. Over 945,000 Oregonians have been fully vaccinated, and about 1.5 million of us have received at least one dose. Now, as Governor Brown said earlier, we are approaching the major milestone of opening vaccinations to anyone in Oregon 16 and older. But at the same time, we are confronting emerging and more contagious variants. According to the CDC, the B.1.1.7 variant, which is rising rapidly in Oregon, is now the dominant strain of the virus in the U.S. Many states, which are ahead of Oregon in the spread of B.1.1.7, are seeing their hospitals fill up with patients with COVID-19. But the good news is that we all have the tools to protect ourselves and our loved ones by wearing masks, keeping our distance, and limiting high-risk indoor gatherings. And starting Monday, many more of us will have another tool, access to a vaccine. COVID-19 has been a formidable foe. The disease respects no age boundaries or demographics. The largest increased illnesses in Oregon are in people in their 20s. The second biggest increase is in people in their 30s. Hospitals around the U.S. are seeing more people in their 30s and 40s admitted with severe cases as the virus continues to mutate and spread, according to the CDC. We know what new mutations will bring: more rapid spread and more people in the hospital. But we also know what Oregonians do when faced with this virus. They fight it, wearing our masks, keeping our distance, and limiting higher risk indoor gatherings. And now, by getting vaccinated. The existing vaccines have proven to be highly effective at preventing against serious infections that result in hospitalizations and deaths from this virus. Now, let me briefly address the situation with the Johnson & Johnson vaccine. On Tuesday, OHA asked all the state's vaccine providers to immediately pause administering the vaccine following an announcement from the CDC and the U.S. Food and Drug Administration. The recommendation was made pending reviews by both agencies into 6 cases of a rare and very severe type of blood clot in women ages 18 to 48 after they began showing symptoms within the 2 weeks following vaccination. This action shows that our safety monitoring works, picking up a potential issue early. None of the reported cases were in Oregon, where we've administered more than 85,000 doses of this vaccine. If you've received the vaccine and have gone at least 3 weeks without side effects, you won't develop this condition. If it's been less than 3 weeks since you've gotten the vaccine and you develop a new severe headache, severe abdominal pain, shortness of breath, or leg swelling, seek medical care. I recognize that this is concerning for many of you who have either received the vaccine or were looking forward to get it. But let me repeat, the COVID vaccines we're using in Oregon are safe and effective. We look forward to an update on these cases in the coming week. So make a plan to get vaccinated. Do it to protect yourself. Do it to protect your family and friends. Do it to protect your colleagues and neighbors. And do it to protect your communities. And for all of us, you can register through Get Vaccinated Oregon web tool at getvaccinated.oregon.gov. The CDC also offers a vaccine finder tool at vaccinefinder.org, where you can just type in your zip code to find vaccines near you. You can always get help by texting ORCOVID to 898-211 or emailing orcovid@211info.org. Getting enough people vaccinated to achieve community immunity may take many months, but will happen more quickly, and we can keep the virus from overtaking us if we remain faithful to the public health interventions. We in Oregon have made tremendous progress in turning the tide of COVID-19. Thank you for your diligence at wearing masks, maintaining physical distancing, and coming soon, getting vaccinated. As I've said before, this is not forever, but just for now. And with that, I'd like to turn it back over to Governor Brown.
Thank you, Dr. Seidlinger. And Director Allen, did you have an additional comment you wanted to make?
Yeah, thank you, Governor. I just realized that I had misread a number earlier when I was talking about the number of seniors vaccinated. The number I read was the total number of seniors. The number vaccinated is actually 563,370. Apologize for the mistake.
Thank you, Director Allen. With that, we're ready for questions. Liz, do you want to take the cue, please?
Yes, thank you, Governor. We're going to go first to Lisa Balick with COIN. Lisa?
Yes, good morning. Two questions. One first for the governor. Have you gotten a response back from your staff's meeting with the White House COVID team almost 2 weeks ago in terms of vaccine allocation?
We are in conversations with our federal partners. They certainly are listening and hearing our concerns. And in the meantime, I'm going to be requesting Oregon receive additional vans complete with vaccinators to assist in reaching or hard to reach communities.
And a question for Director Allen. You talk about the fact that we're seeing the increase. I'm sorry, for Dr. Seidlinger. You talk about we're seeing the increase in younger people in terms of serious illness and hospitalizations. Is that primarily just because most seniors are vaccinated?
I think what we're seeing is that, yes, our seniors are vaccinated, and particularly the older seniors are less represented in cases and hospitalizations, and that certainly is due to the vaccination efforts early. But we're also seeing alarming increases in cases in young adults and older children. And so those two things together have caused that increase in cases that we're seeing as a percentage and as a total number of cases.
Thank you.
Thanks, Lisa. We'll go next to Lincoln Graves from KATU. Lincoln?
Yes, thank you for taking my question. I wanted to ask you about vaccine equity, and I have a couple of questions, a quick follow-up after the first answer. In regards to vaccine equity, what do you think is the driving force? Is it unequal or unfair access, or is it vaccine hesitancy, and how do you know?
Lincoln, let me be perfectly clear. We are doing more than we have ever done before to reach our historically underserved communities of color, our Black, our Latino, Latina, Latinx, Pacific Islander, Asian, Indigenous, tribal, and Native American communities, but it's not enough. We certainly are welcoming concrete suggestions and advice, and my office is proactively reaching out to our partners to solicit additional recommendations. Director Allen, do you want to follow up, please?
Sure, I would just add to that that the Latina population in Oregon is very large. It's geographically very diverse. I think certainly there are absolutely barriers to access. I think to this point, demographics have been working against us a little bit because the population is quite a bit younger than the average Oregonian, and so they've not been eligible until fairly recently in the main. And we've taken steps to try to address those issues, but clearly we're not making enough progress and need to reinvent our strategies and double down.
And my follow-up in regards to vaccine hesitancy, obviously the Johnson & Johnson issue has increased skepticism out there. Battling this, it's certainly a heavy lift. Are you up to the challenge? Do you have a strategy to battle this?
Lincoln, I'll just say I'm one of 6 million Americans that got the Johnson & Johnson vaccine, and I'm incredibly grateful for the protection that it provides me from serious illness and death from COVID-19. As you are well aware, these impacts are extremely rare, and the CDC and the FDA are taking these actions, and the state of Oregon is as well, out of an abundance of caution. Our top priority is to make sure that safety is at the forefront of our efforts. In terms of hesitancy, I will just tell you that the Oregon Health Authority is working with community-based organizations and a number of media companies to get the information out about the vaccines and the impacts of the vaccines, their safety, their effectiveness from serious illness and death. I'll let Director Allen talk a little bit more in detail about the efforts. but it's critically important if we want to lift the safety restrictions that the pandemic has forced upon us, that we get as many Oregonians that are 16 and over vaccinated as fairly and as fast as possible.
I would just quickly add to that, we have a number of communications contracts and efforts in place right now to do a variety of communications campaigns micro-targeted at various audiences with the messages that we think are most effective at reaching them and overcoming hesitancy. You know, I think hesitancy based on fears or concerns or misunderstandings about information certainly is a concern. I'm actually even more worried about, as we move to younger and younger people being eligible for the vaccine, people just not thinking that it's really important for them to get the vaccine because they don't feel that they're at very much risk. And they individually may not be at very much risk, but disease spreads from people to people. And if they get it and pass it on, eventually it will get to somebody who's at risk. And that's really one of the messages I think we're going to have to work on communicating, is that notion of you're not getting the vaccine just for you, you're getting it for your friends, your family, and your community.
Thank you.
Thanks, Lincoln. We'll go next to Amy Green from the Oregonian. Amy?
Hi, thanks. This question's for the governor. I am trying to understand your thinking process here. I'm wondering if you can explain. We heard Dr. Seidlinger talk about the huge week-to-week increases in Oregon. The New York Times is reporting, even though Oregon has the third lowest case rate, it's now about middle of the pack, about 24th or 25th highest in the past week, rate of cases increasing. We now have 8 new cases of the variant first detected in South Africa here, 4 cases of the Brazilian variant. That's new this month for the South African variant. Why not tighten restrictions? You've actually loosened them by making it more difficult for counties to enter the extreme risk zone. So what I'm trying to understand, is it one of the following 3 reasons, or can you explain more? Is it that you think the levels in Oregon of COVID-19 haven't been that bad, and we really, we've been through a lot of restrictions and we don't need more? Is it along the lines of what Gretchen Whitmer in Michigan is doing, that she doesn't think that people will listen to more restrictions? Or is it just a general need to protect the economy?
Thanks, Amy, for the question. The metrics that we put in place, the restrictions that the pandemic has forced upon us, were put in place to keep Oregonians safe, to prevent deaths, and very much to preserve hospital bed capacity and ensure that we had adequate capacity in our healthcare workers. With the advent of vaccines, that dynamic has shifted. And given that Oregonians at this point know how to take personal responsibility, to wear masks, to socially distance, to do the right thing to protect themselves and their loved ones, and the fact that we have roughly 1 in 5, 1 in 4 Oregonians vaccinated, it made sense to me to ease the one restriction that in extreme risk that closed the economy down. So as always, this is a balancing. I think Oregon throughout this entire pandemic has gotten it right. Oregonians have made really smart decisions and tough choices to protect themselves and their neighbors and loved ones. And I am confident we are working as quickly as possible, as fairly and equitably as possible, to get vaccines as arms, that we can continue to keep people safe under the restrictions that we have in place.
Thank you.
Thanks, Amy. We'll go next to Christian Fodenvens with OPB. Christian?
Hi, Governor, this is for you. News code data shows that 40% of people in Oregon's wealthiest neighborhoods have been vaccinated. That's almost twice that of the poorest neighborhoods, where just about 26% have been vaccinated. Were you aware of this inequality, and what's your reaction to it, and what's the state doing to make sure poor Oregonians have a fair access to the vaccine?
Yes, I am aware of these inequalities. Like I said, we are doing more than we have ever done before, and it's not enough. I am absolutely committed, and I know that the OHA team is committed to doing better. There are a number of efforts to reach these hard to reach communities, from literally taking vaccines into the neighborhoods via vans, to working with community-based organizations, from SEI to the Asian Health Center to partnering with our federally qualified health centers. Can we do more? Absolutely, and we're absolutely committed to making that happen. Dr. Allen, would you like to add anything?
I would just add that this has been a nationwide phenomenon, and part of the challenge is people of means have got more ways to be able to access vaccine than others do. Throughout much of the last number of weeks, you've been able to find, for instance, pharmacy doses available in Southern Oregon, Eastern Oregon, those kinds of places. And if you've got the ability to take work and hop in a car and take a 4 or 5 hour drive, you've had access to vaccines. And that's a headwind that we're running into. The governor outlined the kinds of steps that we're trying to take and that we're increasing, particularly as we keep getting more and more doses, to provide more vaccine closer to where people are, where they need it, and where they don't face those same barriers to be able to get access.
And Christian, just let me say for the record, these kind of inequities, whether they're income-based or race-based, are absolutely unacceptable. And we, all of us collectively, have to do everything in our power to eradicate them. And at the beginning of the vaccine distribution efforts, I asked my fellow Oregonians to be considerate and thoughtful of others. We have had to create pathways to ensure that our most vulnerable Oregonians get vaccinated. And we are continuing, we are all ears in terms of hearing from our community partners that have suggestions or advice about how we can do this better.
Thanks.
Thanks, Christian. We'll go next to Alicia Rubin with KDRV.
Hi, thank you so much for taking my question. Governor Brown, you mentioned a request for vans from the White House in your conversation with them. Has that request been approved? And is there a plan to put those vans in place throughout the state?
The answer is no, it hasn't been approved. It's still a work in progress. Yes, the Oregon Health Authority has a plan to utilize these vans throughout the state. I will just say, I know that the Oregon Health Authority funded a van for the Whitebird Clinic in Lane County, Oregon. Their focus is on reaching these hard to reach community members, and I know they're looking forward to receiving your van quickly. Director Allen, do you want to add anything to that, please?
No, Governor, I think you summed it up really well.
If you don't mind, I just have a quick follow-up as far as how many were requested.
We will be requesting enough for each one of the hospital regions.
Thank you.
Thanks, Alicia. And we have time for 1 or 2 more questions. We'll go next to Carmen Montez with Univision.
Thank you, Liz. Governor, can you tell me why the communities that were largely impacted by the pandemic were not prioritized from the beginning after healthcare workers, knowing that they were the most impacted in the state?
So, Carmen, from the beginning, in terms of vaccine distribution, we have unfortunately not had enough vaccine to meet demand. Equity, making sure that we distribute vaccines and provide health care for our most vulnerable community members, our historically underserved communities of color, has been at the center of our efforts. We have largely followed CDC guidelines. As you are well aware, I made some decisions to vaccinate our educator workforce. I did that because I want to make sure that we got our students, particularly our students of color, back into the classroom as quickly as possible. We know that there is an opportunity gap in our education system. We know that the pandemic has exacerbated that opportunity gap. And we know that in-person instruction is the best way to deliver education for the vast majority of our kids. That's why I made the difficult decision to prioritize our educator workforce, because I wanted to get our kids, particularly our historically underserved kids of color, back into the classroom as quickly as possible.
I have a follow-up question, and this one's for Dr. Allen. Has there been a clear goal as to how many vaccines have been or will be, I guess, designated for the Hispanic community or Latino community in massive vaccination sites, such as the Oregon Convention Center? And if so, has there been any data as to how many Latinos have been vaccinated at these sites?
So our broad goal is parity. We want to make sure that all populations get vaccinated at more or less equal rates. Part of the conversation the governor is facilitating on Monday will be to come to some agreement about what kind of a target, what that target would look like, and particularly over what kind of a time frame. I don't have data with me today about race, ethnicity at vaccination sites, but we can see if that's available and provide it.
Carmen, we have a number of other efforts to make sure that we get vaccines in the arms of our Latino, Latina, Latinx populations. Serena Cruz, the director of the Virginia Garcia Foundation, reached out to us a handful of weeks ago asking for additional vaccines for federally qualified health centers, as well as making sure that they could vaccinate all of their patient population. We agreed to that request. It's been extremely successful, and we will continue to partner with them. We also have efforts with individual employers around the state to vaccinate employees at the work site. We found this to be incredibly effective and efficient. We're also partnering with our CBOs. For example, had a conversation with Ron Herndon at Albina Head Start, where they have a program that delivers food to their families, and primarily a Latino, Latina, Latinx population. And we're working to coordinate to make sure that we can get these families the education and information and the vaccines that they need.
Thank you.
Thanks, Carmen. We'll go next to Julia Silverman with Portland Monthly. Julia?
Thanks so much for taking our calls today, Governor. As you've said, Monday marks your deadline for a return to at least partial in-person school for middle and high schoolers statewide. But we know from the Oregonians reporting that that return looks different depending upon where you go to school. There's more hours in the building with their teachers for kids who live in predominantly white, wealthier areas, and significantly fewer for those in more demographically diverse, historically underserved areas, particularly in East Multnomah County. Given that demonstrated inequity, and given the consensus from the CDC that with precautions in place, there's extremely limited transmission in schools, do you have any plans to join Governors Charlie Baker of Massachusetts, Democrat Governor Laura Kelly of Kansas, Chris Sununu of New Hampshire, to issue a mandate requiring school districts to open full-time 5 days a week, no matter what, in the fall? And if not, why not?
Well, in terms of the fall, I fully expect that we have our students back in the classroom every single day, weekday of week. In terms of individual communities, I've had conversations with superintendents from the metro area region. They are working with their community members, their families. They want to make sure that their families are safe. And that's why we're working so hard to make sure that we get vaccinations in arms in communities around the state.
Okay, but just to follow up, you're saying that at this time you are not planning to issue a mandate requiring full-time 5 days a week in the fall?
I've been really clear. It is my expectation that we will have kids in school 5 days a week in the fall. Obviously, the virus makes the timeline. We don't make the timeline, and we are working as effectively as we can, as equitably as we can to get vaccines in arms so we can ensure that that will happen.
Thanks, Julia. We have time for one more question, so we'll go to Suzanne Roig with the Bend Bulletin.
Yes, hi, Governor. Thank you very much for taking my question. My question is about the breakthrough cases that we're seeing, and I'm wondering if what Oregon Health Authority is planning to do to help combat the concern that it's raising among people in the community.
Thanks, Suzanne. I'm going to turn that question over to Dr. Seidlinger.
Thank you, Governor Brown, and thank you, Suzanne, for that question. The report that we put out on breakthrough cases is COVID-19 that is developed in people more than 2 weeks after they were fully vaccinated. We had 168 individuals, several of whom were hospitalized and 3 of whom died. Unfortunately, no vaccine is 100% effective. And so we did expect some individuals to develop disease after receiving vaccines. And the CDC released some national data on that. These cases represent a very small number of the people who were vaccinated. They do show some severe disease following vaccination that wasn't picked up in the initial clinical trials that dealt with tens of thousands of people. We're now talking about hundreds of millions of people across the United States who've been vaccinated, most of whom have not developed COVID. And this very small subset is unfortunate, but unfortunately something that we anticipated. But as more and more individuals get vaccinated across the United States and in Oregon, we're going to see less opportunities for transmission and even less breakthrough cases. These vaccines that we have are highly effective at preventing disease and preventing the most serious disease, and they are safe. So we continue to urge Oregonians, as your time comes up, make an appointment, get in line to get your vaccine, because that's the way we are really going to win this fight against the virus.
Thank you very much. I appreciate that.
Thanks, Suzanne. And with that, I think we're out of time for questions. Just want to say thanks to all of you for joining us today. Please stay safe out there and have a great weekend.